Good afternoon, everyone. Thank you for tuning in to Bermuda Health Council for today's discussion. For those who are unfamiliar with Health IQ is a symptom reporting tool that helps health authorities understand the trends in population health, which will help reduce the spread of COVID-19. Today, we will address your questions and the importance of Health IQ with our local senior technologist, Mr. Lee MacArthur, and developer Gabe Jones. Hello.
Hi there.
Thank you both for assisting us for today's Zoom chat.
Thanks for having us.
Yes, I'm sure you guys are quite busy, and we really appreciate you for taking the opportunity to answer any questions that the public may have. Gabe and Lee, can you just please briefly, one by one, tell us more about your role and the purpose of developing Health IQ?
Interesting story. So Gabriel and I have been working together for many, many hours since March, and we've still never met in person, even though we live 2 miles, 3 miles away from each other. Mostly, obviously, due to lockdown and COVID, and now more so with the children and everything else on my side. But this project started in early March. There's a social website called Reddit, and there's a subreddit here dedicated to Bermuda, which is usually filled with, photos and videos of the island, lots of other local topics. And I threw a question out in early March to the community with a sort of a mock-up or a sort of a sample map to say, hey, listen, this was well before our first case was ever detected in Bermuda, but wouldn't it be interesting if we had a map where we could track the progress of the disease and testing and everything else. And feedback was really great, but it just so happened to coincide with Gabriel, who's going to school in Scotland at the time, who was on his way back on one of the last flights to the island, who sort of said, hey, listen, I've got nothing but free time for the next few weeks. I'd be interested in helping. And the rest, they say, is history. But Gabriel, I can see you're back now. And maybe you can provide, your background would be helpful as an introduction.
But yeah, just from what I heard Lee say, we kind of met on Reddit with this kind of joint idea to create this kind of symptom tracking tool. I had nothing but free time as I was quarantined for 2 weeks, and then of course the lockdown started, I think on the same day that my quarantine ended. So I had no abundance of or no shortage of free time to work on this. But yeah, we got together just thinking that wouldn't this be a cool thing to make for Bermuda? Wouldn't it help health authorities kind of get a leading indicator on some of the data? I was just flying back from Edinburgh at school. I didn't have much on my plate, so yeah, that's kind of the origin story of Health IQ.
Yes, thank you both. This tool is so essential right now, and a lot of people aren't really aware of its assistance during this period.
I think one of the things that was helpful around the time we were developing this tool was that we got to see how other countries had attempted to do something similar, and one of the things I think we found, one of the things we decided early on was that a tool like the Health IQ needed to be run by proper health authorities and not by private citizens. Lots of these tools in other countries are run by Facebooks and Googles of the world. And we thought, especially in our community here in Bermuda, that this is the type of service that needs to be run by somebody like the Bermuda Health Council. And so when we were ready to go with the product, leave it to an island like Bermuda to quickly take a tool like this and get it into the right hands through the Ministry of Health, through the Bermuda Hospital Board, through individual doctors' contributions and everything else, we ended up with the Bermuda Health Council pretty quickly, and we've been excited about this partnership ever since.
Yes, we knew at the Health Council population data will help support the community as we move through each phase of the COVID-19 restrictions. Gabe, some users have experienced complications when inputting information. Can you kindly demonstrate how we could use the application?
Sure, yeah. I'll just share my screen here. So this is Health IQ. As you can see on the map here, it's weighted with the colors of kind of our general submission data. The more blue it is, the more healthy people are in that postcode, and the more red it is, the more potential cases we have. You can also see up here medically vulnerable tab, where you can see a breakdown of medically vulnerable people per postcode as well. All right, so I'm gonna run through a basic submission process in the top right here, just to show you guys exactly how you can go through it. It's pretty easy, but yeah, let's go through it. Let's just pretend that I'm feeling unwell today, and I wanted to report my symptoms on this website. So I would click unwell up here. The first thing it does is ask you for a phone number or email. This is optional, but if you do input it, we can use that to contact you, to remind you about inputting more data. And we can also use it to send out public health alerts. So if you wanted to get kind of more in the loop about COVID in Bermuda, this would be one of the ways to do that. For now, I'm just going to skip that, just so I can show you guys how to submit an unhealthy case. It'll list a few symptoms here, and the idea is you just kind of click on which symptom you're feeling. So let's say I had a fever and cough and I was throwing up a bit. And then it gives a few more kind of detailed fields here. So what your highest temperature is, maybe like 101. Am I able to tolerate fluids? It'll ask some questions like that depending on which symptoms you select here. And that'll give health authorities a kind of better idea of your health without official testing. Next up is demographic information. This is where we collect data regarding kind of population health outside of just unwell people. So this can be used for medically vulnerable people. For example, on the left here, you can see a map over here of medically vulnerable, and that is based off of all the data selected here on the right. So first off, we're just going to start off with some information about us, how many people in our household, postcode, how old you are. And this is information that the Health Council can use to give the government better statistics about how COVID is spreading in Bermuda, and more control over understanding that data. Next up, we're going to go through these survey questions on the right here. Most of these will be no, but let's just go through them. Have you had close contact with a person with COVID? No. Have I been tested? No. No pre-existing medical conditions. I'm not a healthcare worker. I do have a GP. I do not smoke. And no one in my household has symptoms for COVID. Most recently, we've added these last two questions. Do I see people wearing a face mask in public, and do I see people physical distancing? And for me, I would say yes to both of those. Yeah, so then you would click submit. I'm not going to do that because I just don't want to submit an unwell case to the site. However, you would click that and it would go through and say report submitted, and we would accept your report. And then when you come back to the site, if you enter the same email as you used to sign up, it should retrieve all that data again that you just input, so you don't have to do that every single time. So we've tried to make it as user-friendly as possible, as easy as possible. Submitting a phone number or email, you will be asked to give a verification code. So let me just demo that real quick as well. Let's say I was submitting a healthy case and I put in my email here. It'll ask for a code that it sends you. If you use a phone number, it'll also give you the option to call that number. So you can use your landline if you want for verification. We're trying to make this as open for everyone to use, regardless of, if you have a mobile phone or not. But yeah, that's a basic run through just the kind of easy functionality of our site. I hope that answers everyone's questions about how exactly to run through it. Yeah, I'm gonna hand it back to Lee now for the next couple questions.
I think it's important to note as well the symptoms that you see and what you're able to select when you choose to say that you're unwell. These symptoms we've selected there aren't at random. We actually follow the Bermuda Health Board's symptom checking utility, or what they call their scorecard. So our service mirrors the BHB's COVID-19 symptom checking utility to the T. So if this website says you're a potential match for COVID-19, it would be the same result if you were speaking to someone from the BHB who was asking you the same questions about your symptoms.
Thank you. Is there a specific web browser that we should use or mobile device? I know that seems a bit extreme, but I know that certain web browsers limit us as far as information.
Yeah, technology is fun, and trying to build technology for the masses is not always easy. I think generally speaking, the way that the design and the way that the technology was built was to be sort of browser agnostic. That is to say, though, however, it does lean towards popular handsets. So if you're using a mobile phone, iPhones, common Android phones, we definitely lean toward building a service that addresses the largest percentage of the market possible. The same thing from a desktop browser or an iPad browser. If you're using Chrome or Internet Explorer, chances are you're fine. If you're using more of a maybe not as popular web browser, you may have some issues there. However, generally speaking, my feedback to anyone that's having issues, displaying the site on their phone or a desktop or a tablet, just to try another browser, and chances are 9 out of 10 times you won't have an issue.
Okay, that's good. And I know that we received a few questions prior to this session. We will also take more questions towards the end. What has been completed with the Health IQ application so far?
Sure. Well, I think in terms of accomplishments, it's pretty amazing to see how the community at large has really, taken this service in both arms and used it. We're about to eclipse our 7,000th reported symptom case, if you want to call it that, by nearly 5,500 residents of the island. Which is a lot in itself. But when you tally up, one of the questions asked during the symptom report is, how many other people do you live with? And if you add up all of the people, that number for every one of these cases, the amount of people that have effectively reported their health through the website is north of 20% of the population of the country, which is a massive achievement at this point. And that all comes back to the guidance from the BHB, the continued tweaking of the service. COVID-19 is a fairly fluid situation, and so the understanding of being able to understand who's medically vulnerable and who's not, and being able to capture that information, I think has been an accomplishment on its own. I think it also is important to point out that as of last week, the Ministry of Health announced that the Health IQ has been included in the 11 sort of data points in this traffic system in terms of reopening indicators. So there are 3 indicators that are directly related to the Health IQ in terms of the reopening of the country, back to the new normal. So that in itself, I think, is also quite an accomplishment, and it says a lot about our community. Again, willing to help everyone get through this together.
Now, I know it has been suggested that we should share our symptoms on Health IQ as frequently as possible, but we really don't know what that frequency looks like. Is it weekly, monthly, daily? Lee, can you give us an idea of the timeline of inputting our data?
Sure. Quick to point out that Gabriel and I are not doctors. So we've been following the guidance of the Bermuda Health Council, their partners in the Hospital Board and the Ministry of Health, and also, similar services around the world. So given the incubation period of the disease is as long as 14 days, we suggest, updating your symptoms at least, every 14 days, if possible. In fact, Gabriel has built an interesting feature where if you have shared your email address or your phone number, we'll actually send you a reminder over text or over email to come back and update your symptoms. But I think it's more important, or equally important, to remember that if your symptoms change or you develop you've gone from feeling well to unwell, whether it's been 14 days or 4 days. It's also important to come back and share the change in symptoms, because all of a sudden developing a runny nose to you might seem fairly benign, but if there's a cluster of folks at a certain part of the island that are all of a sudden developing runny noses, it's probably something that health authorities are going to want to start to watch, because I guess the point of a service like this is to try and forecast where the disease may spread, and these early indicators are awfully helpful that way.
Exactly. Thank you, Lee. Gabe, can you tell us what type of information?
So the information we collect, if you press unwell, it'll collect symptom data and any other kind of specific medical details like your highest temperature. For demographics, this is for all cases, we collect the information you saw on that card. So stuff like those survey questions about public distancing, COVID symptoms in your house, demographic information like your age, your gender, general stuff like that. We also optionally collect your phone or email, but this is used only for alerting you about coming back to the site every 14 days, like Lee said, and in future possible health updates for your postcode. We're still working on that. Additionally, that data is kind of used to collect information about people's medical vulnerability. So just as a whole on the island, we can tell where and what kind of medical vulnerabilities people have. So are people smoking? Is there a high percentage of people who have pre-existing conditions that are at risk? And that's almost or just as equally as important as the symptom data itself, because it provides the Bermuda government that kind of information, that insight into how Bermuda's population will react to something like a COVID outbreak here.
Now, Lee, how will the data collected be used to advance the fight against COVID?
Great question. What started out as an interest, sort of a curiosity as a resident here, just looking to see how the island was faring from a health perspective. There's been a heck of a lot of science and new reports published over the last even 3 to 6 weeks that has really been beneficial to help answer that question. So I think first thing is, a lot of people ask, what is a leading indicator? So the health IQ has been wrapped into the reopening category of a leading indicator. And so, and leading indicator versus a lagging indicator. And so you can look at something that we all kind of understand really well, which is testing, as both a leading and a lagging indicator. So testing is a lagging indicator from the perspective of, we've tested, a percentage of the population, and we can understand that they're healthy or sick. But at that point, they're already sick. In that perspective, it's a lagging indicator. But at the same time, it's also a leading indicator. So if you see hotspots on the island of people that have tested positive, it also can act as a leading indicator in that way to say, like, hey, this may be a part of the island we need to focus on. But this sort of what we call sort of crowdsourced community symptom data, it's both accurate, valuable and useful. And there's a study that was published just middle of last month as a collaboration between the Massachusetts General Hospital, King's College London, University of Nottingham, and a private health organization called Zoe, where they analyzed 2.5 million community symptom reports across the US and the UK. And they found that this crowdsourced symptom data to be nearly 80% accurate in terms of determining whether someone is potentially positive for COVID IQ. So if you're feeling symptoms that are a potential match and you're reporting those things, and obviously you're being honest about it, well, there's a 80% chance or greater that you may actually be indeed positive. So that's the value of the data. What's really interesting in terms of how it's used is, if you take a look at, there was a report that Carnegie Mellon University published back in April, working with Facebook and Google. They looked at, again, millions of community symptom reports, and found there was a high correlation between the symptom reports and actual test results in specific locations. So they started to use that data to forecast out up to 4 weeks ahead of time, where the disease may spread. And so in terms of, how that data can be used, you can imagine both from, an operational perspective for the epidemiologists in Bermuda and, folks at the Bermuda Hospital Board who are trying to, actively defeat the disease. They can deploy resources on the island in advance of an outbreak if they understand that, the, elements of the community health are deteriorating. At the same time, from a political perspective, you can imagine how this might even be able to help things like policy and craft proper government policy that matches, where the disease is headed and not where it's been. So, pretty exciting to see how useful this information can be. I think that's a great question, because people ask, why take the 2 or 3 minutes to share my data, with the Health Council? How could it possibly help? And hopefully that helped answer that question.
It did. It actually answered a few other questions as well, because I know a lot of people, are concerned about, one, their information, and what is the purpose of collecting that data. And that actually leads to the question, I think you sort of answered it. What impact do you hope that this app will have for the community of Bermuda? I know for the Health Council, we want to see our population become the healthiest population on the island, or any island that is. So what do you see, Lee, as being, sort of a solution for the community of Bermuda, or how do you see it?
Well, I think, Gabriel and I both, when we started this project, the idea was to try and get through this as quickly as we can. How can we help? We're both technologists. We understand how to build things, and we saw it as an opportunity to help both increase the sort of insight of the health of the community back to the community, so people understood how we were performing, but more importantly, to help get that data to the hands of health authorities, so we can get through this as quickly as we can. I mean, the implications on our mental health of staying home and teaching our young kids, and the impact on our economy, that these things are it's not great, and we're trying to help get through this as quickly as we can. And so ultimately, Gabriel and I would be absolutely proud to do anything we can to help get through this faster. So that's, I think, Gabriel, if I'm putting words in your mouth.
No, that's perfect. I want to also address data privacy. One of the questions that came up about, inputting your information is concern of data being leaked. Can your data be leaked by inputting your information into Health IQ?
It's a great question. So I'll start first by saying, we take security and privacy very seriously. This is obviously a sensitive topic when it's not related to your personal health. Now, and all of a sudden you're reporting how you're feeling, that's something that you have to take a lot of care of. When we first launched the site in early May, one of the first things that we heard from the community was like, hey, listen, we're not comfortable sharing our phone number as a requirement to share our data. There was a very high percentage of feedback that people were willing to share that information, but it was clear that there was a massive chunk of the population here that just was not comfortable doing that. And so one of the first changes we made in terms of data security and privacy, or in early May, was to remove the requirement to provide any personally identifying information at all. So as of today, as Gabriel showed you in the demo, you can come and report your health without sharing anything that actually identifies you at all. You can share your age and your gender and what postcode you live in, but nothing that could actually be attributed to you as an individual. And we thought that was a really important move early on, and we understood that. I think one of the things the Bermuda Health Council really helped with in the early stages as well was to seek out consultation from the Bermuda Privacy Commissioner, Alexander White, so to ensure that we're following all best practice in terms of data privacy, security, data residence, those sorts of things. And so It's data privacy and security is not something that you can sort of set and forget. You have to constantly monitor and ensure that those things are secure. I think it's also important to point out that the data that is collected, whether there's email addresses or phone numbers provided or not, that data is under the strict control of the Bermuda Health Council, as is the access to it. So, and that's to ensure that the data is used by the proper people for the right purpose, which is even more important. But at the end of the day, I think by removing any requirement to provide personally identifiable information, that is something where if you're worried about a data breach or anything like that, that is ultimately the reason why that feature was added to the site, to allow anonymous submissions.
Yes, thank you so much, Lee. Just to clarify also, the Health IQ is only an online application. It is not a downloadable app that someone can find in, the Google Store or Apple Store.
Yep, correct. Yeah, at this point, and even back when we launched the service in May, the app stores of the world, via Google and Apple, were not allowing app submissions for health or COVID IQ related apps unless they were coming from health authorities, and also it would take 3 to 4 weeks to get those things into a store. Those were some reasons for not developing an app. More importantly, there's no feature currently in the Health IQ service today that actually requires an app, that needs it to be something that has to be downloaded. So it was something to deliver that was optimized for phones and for desktops, but that didn't require anyone to have to go download anything in advance, which is a whole other step that people can get tripped up on.
Perfect.
Yeah, just healthiq.bm, straight from your phone, your desktop, or your tablet, and no need to download anything at all.
Yes, and I'll insert that link right now so that everyone is able to access it. And if anyone have any additional queries about the app, you're more than welcome to contact the Health Council directly. You can contact us through email, healthcouncil@bhec.bm, or you can give us a call Monday through Friday between 9 and 5 at 292-6420. Also, Lee, could apply to improve other areas of public health in Bermuda?
This is where you'd need, Dr. Brathwaite on the call to answer that question. The Health Council has some really interesting ideas about how a service like this can be used beyond COVID to help improve health on the island in general. I think in the short term, obviously COVID is sort of the main focus. However, as Gabriel pointed out earlier, being able to address the medically vulnerable population in terms of feedback, creating feedback between the Health Council and that population, ensuring access to services and notifying vulnerable population where services are in terms of local to them, and how they can access things like pharmacies and doctors' offices and things like that. But I think the Health Council has a lot of ideas around how the idea of sort of crowdsourced symptom communication tools like this could be used, beyond COVID, and we're excited to be a part of those plans.
Yeah.
Thank you both. At this time, we will go ahead and take anyone's questions. I know we're getting close to the end of the hour. You can submit your questions under the chat section, or you can click the hand icon, and I will be happy to unmute you.
I do see one question in the chat, which is
yes.
One asking if each time you access the website, you're a new user. And this would be true if you didn't provide your phone number or email, but if you do input that, every time you reload the site again, it will remember your last submission and automatically fetch it for you, so you don't have to submit that data again. Alternatively, if you're on a different browser or another phone, you just put in your phone number and verify it again, and it'll fetch that data for you. So it doesn't count you as a unique user again if you use a phone number or email as like your identifier.
Exactly. And just to remind everyone, it is a quick process. And if you do input the information, most likely, just like any other web browser, it does save your information. So you can just quickly go through each questionnaire as quickly as possible.
Good afternoon, everyone.
Good afternoon.
I have two concerns. The first one is I sort of keep track every day of the COVID virus through the email, and I noticed that right now we have 9 people in Bermuda, 2 that is active in the hospital, and 7 at home. And I was wondering if we couldn't just first, instead of like opening the country now, just wait until all 9 people get better before we just fully open back. If that would be impossible, to just wait until all 9 get better and then we open. That's one thing. And another question, I was listening to an overseas news that says that there's a country in Europe that has defied the World Health Organization and did an inquest and did an autopsy on one person that got the COVID virus, and they realized that the person died. It's a bacteria and not a virus, and the person, they really have thrombosis, which is really clotting of the blood, and they say at least 100 milligrams of aspirin, 100 milligrams of aspirin can help a person to get better, and in no time they would be well. So my second thing is, isn't possible like to give all those 9 people some milligrams of aspirin and see if everybody get better, something like that? You see what I'm talking about. Thank you. That's my question.
Thank you, Kiva, for your question. Just to let everyone know that we aren't medical professionals. We are here to provide assistance with helping the community progress to the next stage of COVID. However, Kiva, if you have questions about how we should take our next steps into ensuring that the community stays healthy and well, you're welcome to contact the Health Council. We could find someone that can address those questions. Again, anyone that has medical queries, you can contact us at healthcouncil@bhec.bm or give us a call at 292-6420.
Yeah, I guess I wouldn't even say this as a developer perspective,
yes,
because I'm not, but in terms of the country opening, the Bermuda Ministry of Health has published these 11 sort of data points that they're looking to in terms of reopening the country, and in particular, there are, under lag measures, there are two sort of columns of data they're looking for. Active cases and hospitalizations that are all currently in the green, but they're also looking to watch how future transmission and what our WHO country classification will be. And those areas are still in yellow. But, I think we're on, knock on wood, I think we're on 9 days in a row now of no new cases. And I think that's the trend that we're all looking for.
Yes. Also, we do have another query here in reference to the survey questions on health IQ during the risk assessment based on algorithm and also based on its model. What is the reference model and who will make the change? When and how will it change the disease demographics? So as COVID progresses, as we understand, more about the virus itself, how will the modeling change, or will it change?
Sure thing. So we mentioned this earlier, potentially before this person joined, but early on, Gabriel and I made the decision to make sure that we match the Bermuda Hospitals Board, their sort of model that they choose for determining who is a potential match for COVID-19. And to be honest, that model itself has changed 2 or 3 times since it was first published in March, towards the end of March. So every time the Bermuda Hospital Board makes a change to their algorithm, if you want to call it that, or their model, we mirror that, and we have to log when the model was changed and why it was changed. But to give you an example, at some point, their model changed to include looking for loss of smell and taste, which was a symptom that we did not track, and neither did the BHB for that matter earlier on. So as the BHB changes their model, so do we, and that way it moves those types of decisions into the hands of the people that ought to be making them, and not in the hands of Gabriel and technologists like ourselves.
Thank you so much, Lee. I just want to reiterate some of the messages here on the chat section. But yes, Lee and Gabe, thank you both for all of your hard work you are doing, especially with Health IQ. Many people don't know, but this will definitely help us improve our health here on island. And I do. Oh, go ahead.
One more question in the chat.
Yes, I was just about to address that.
You want persons to go on every 14 days, and yes, we encourage everyone, especially those who are healthy, to come and submit that status, because we want as many healthy people to submit to show how our population is better represented. So even if you are healthy, that'll count as a data point towards reopening the country, which is great. So definitely come back and report your health as often as you deem fit. But yeah,
exactly, as often as possible, especially if you are feeling COVID related symptoms. I think that will be essential in collecting that information and making sure that public health officials are able to contact you and give you further guidance. Thank you, Lee and Gabe. I appreciate you. And of course, if other questions arise during this process, you guys are welcome to still contact the Health Council. We're more than happy to assist you guys during this period.
Yep. Thanks everyone for tuning in.
Thanks everybody.
Thank you all. Have a good afternoon.
You as well.